If your cat has ever been in pain, then you probably have just wanted to do something at home for them. So in this video, we're going to talk about different ways to manage a cat's pain at home. We're going to be talking about specific situations, however, because frankly, to be honest, most types of pain in cats can be treated by a veterinarian and cured. I'm thinking like dental disease or a broken leg or a upset tummy, anything like that, injuries, abscesses, all that stuff. Painful, yeah. Requires veterinary care. It's not really something that you should be managing at home. What am I going to talk about in this video? I'm going to be talking about how to manage your cat's pain after they've had, say, surgery, or how to manage your cat's pain if they have joint pain due to osteoarthritis. So that's another thing that we're going to be talking about in this video. So let's dive in. The most important thing to do when you're trying to help a cat that's in pain at home is to know the signs of pain. Cats have evolved to hide their pain from everybody else, so it can be a little tricky to know whether a cat is in pain versus whether a dog or a human is in pain. So go ahead and take a look on the internet. Just Google signs that a cat is in pain, and you'll learn a lot. You'll see everything from cat grimace scores to a list of behaviors that could be associated with pain or sickness. And this just gives you information so that you know what you're looking at in case you need to help them or get help for them. Let's first talk about cats that are recovering from surgery. So cats that are recovering from surgery, and in this I'll include cats that are recovering from dental procedures, they need time to recover and a place to recover. So what you're going to want to make sure is to provide them an area, a small area to rest and recover in from anywhere from 1 week to 2 weeks. The recovery period is different for cats that are recovering from, say, dental surgeries to orthopedic surgeries or soft tissue surgeries. So you're going to want to get them an area that is relatively small and contained with no opportunities for racing, jumping, zoomies, climbing, all that stuff that they love to do normally. So some people will use a bathroom. Other people will get a very large dog crate. I feel like that's a nice way to do it because then the cat has enough space to move around, but is still someplace where you can watch them. So make sure they have a confined place where they cannot run or climb so that they can recover from their procedure. Make sure it is 68 to 75 degrees Fahrenheit and make sure it has all of their resources: bedding, litter box, food, and water bowls. It is really important for you to help them in this way because they have to stay quiet in order to heal. And cats don't know the difference between being healed from a procedure versus not really. The only thing they know is it hurts, it doesn't hurt. So if their pain is being managed with pain medication from your veterinarian, which it should, then in their mind they think that they're fixed and they're fine. So they'll run and they'll do all their normal things. They're like toddlers, right? They're like toddlers. So it's up to you to confine them so that they don't cause a problem with their surgery. And the major problems with surgery afterwards is the incision gaping open, or stitches being lost, or infection, or excessive inflammation due to excessive movement of those tissues against each other. So you want to make sure they stay quiet. And then you want to give them all their pain medication as prescribed and call your veterinarian if you are worried or concerned in any way along the point of recovery. Pain meds for cats, there are several options available through prescription only, and there's more being released all the time. So we have our standbys, our old standbys, which are the non-steroidal anti-inflammatories. There are a couple of products that are available for cats. I like meloxicam, that's kind of my favorite. There's opioids. We've got buprenorphine and fentanyl, which are used short term after surgeries. We have muscle relaxants. One of the favorites out there is gabapentin. It can be used for a lot of different things. And then we have some newer drugs, the NMDA receptor antagonists. Amantadine is being used to control pain in cats, as well as they have an injectable monoclonal antibody that is given by injection once a month. It's been around for a couple years. And lastly, some veterinarians do use tricyclic antidepressants to control chronic neuropathic pain in cats. So those are your prescription medications that may be prescribed to your cat after they are recovering from surgery. Some of those medications can also be prescribed for other painful conditions, including chronic painful conditions like osteoarthritis, which the monoclonal antibody is used for. Now let's talk about cats that have chronic pain from osteoarthritis, which is inflammation and degeneration of joints, the cartilage that is in the joints. So the first thing is to make sure that the cat's pain is controlled. And this usually does require a prescription strength medication, because if you don't control the cat's pain, then they're not going to want to move, and they're going to be grumpy, and they're going to probably eat more, and it's just going to be miserable. And then we're going to continue this vicious cycle of eating more and not moving and gaining weight and then having more pain, and it's just blah, blah, blah. So it's always important to make sure that you get that pain controlled. Sometimes with the use of at-home and adjunct therapies, you can actually decrease, minimize, and sometimes stop altogether prescription pain meds in cats. How do you do that, Dr. Wooten? Well, the easiest way to do that is if your cat has joint pain and they are overweight, put them on a diet. Work with your veterinarian to help them lose weight to get to their ideal body weight. And you might be surprised at how much better they do. They have studies now, they are in dogs, but they have studies that show that you can reduce the symptoms of osteoarthritis by 25% with weight loss alone. So talk with your veterinarian about a safe way to help your cat lose weight. Don't do it on your own. It can be a little tricky for cats to lose weight. And also you're going to want to work with your vet to make sure that pain is controlled along the way as well. Other things you can do at home to help cats that have chronic pain from osteoarthritis is improve the accessibility around your house. Do you have stairs? Install some ramps. You can use ramps for furniture as well. Do you have slippery floors? You can put down traction mats so that these cats can walk more easily. Make sure that all of their resources are on the same floor, food and water bowls, litter box, all of that, so that they can get around more easily. So let's talk about some alternative therapies, some of which that you can actually do at home. Number one, heat and cold therapy. So for acute injury or acute swelling, you can alternate heat and cold therapy in cats just like you do for people. 10 minutes heat, 10 minutes cold, 10 minutes heat, 10 minutes cold. You're probably laughing at me right now because you're thinking my cat would never tolerate that. And you're probably right. They probably won't tolerate that. But one thing they might tolerate is a heated bed. So one wonderful thing you could do for a cat that has arthritis is provide them a heated cat bed. It's a really nice way. We know that these joints, if they're warm, the joint fluid is going to turn over and they're going to feel better mobility. Also, their muscles won't be as stiff. So a heated bed would be a really nice thing to do for a cat that has chronic pain. There are other alternative therapies that you can do at home. One that I'm actually really intrigued and excited about is the Assisi loop. This is an electromagnetic therapy device that actually has some pretty good science about it, and the people who use it seem to like it a lot for chronic pain in cats. So that is another fairly affordable alternative therapy that you could do at home for a cat that has chronic pain. It's very non-invasive, very easy. Most cats tolerate it. So that's another good option for at-home pain management.
My senior cat, Amber, is 18 years old, and unfortunately, she struggles with arthritis, especially in her shoulders. So when I got the chance to evaluate the Assisi loop, I was really excited. This device is designed to promote healing and reduce pain and inflammation in pets. And it does so by emitting these electromagnetic pulses over a targeted area of the body. These pulses are completely safe, they're non-invasive. Your pet's not going to feel anything while the device is in use. From a human perspective, using the loop is really easy. You just place it over the area that you want to treat, press a button, and then let it work for 15 minutes. I was pleasantly surprised by how calm my cat was during her sessions. Amber usually gets a little nervous with anything new, but she just cuddled up and took a nap as I gently positioned the device where I needed it. It's early days still, so it's hard to say whether the Assisi loop has made any tangible improvements in Amber's health, but I'm optimistic. Overall, it feels like a worthwhile addition to her care, and I plan on continuing our sessions until the device gives out, until the battery dies. One unexpected bonus of using the Assisi loop was the quality time that it afforded us during those 15-minute sessions. It turned into this really nice bonding experience for Amber and I, which was really neat. So if you're looking to relieve your cat's pain or improve their comfort, I would definitely recommend asking your vet about how a product like the Assisi loop can help.
There's other alternative therapies that you can explore at home. You can actually get cold laser therapy. Most people still go to a vet to have it done, but I actually have had clients that have bought cold laser therapy machines and then have done the therapy at home for their pets instead. So cold laser therapy. And then there's other things like acupuncture, massage, hydrotherapy, electrostimulation, lots of stuff. But most of those do require a veterinarian specialist to help you with it. So those are a couple of home things that you can do. Now let's talk about supplements. People love to give supplements because they're over the counter, easy to get, relatively expensive, and it feels good to do something natural. I am also a fan of supplements. I use them. I give them to my pets. I give them to my kids. But you do got to be careful what you're buying because they do not have the same regulatory oversight that pharmaceuticals do. Nutraceuticals are in a different regulation status, at least here in the US. So make sure you're using a product that is tested by a third party for efficacy and purity. A couple of the ones that I like, omega-3 fatty acids from fish oil, EPA and DHA in fish oil. It's fantastic. It's anti-inflammatory. It's not only good for joints, it's good for skin, brain, heart, kidneys. Omega-3 fatty acids are phenomenal. Love them. Another one that I have seen people get some success with is CBD oil. CBD oil is derived from the hemp plant, and it has anti-inflammatory and anti-pain properties. And so there are a lot of different products out there. Make sure you're getting something that is pure and contains only CBD oil and nothing else. It can be a little difficult to dose if you're getting the oil, so sometimes getting chews is an easier way to do it. And then lastly, for cats with chronic osteoarthritis, glucosamine, hydrochloride, and chondroitin sulfate, still really great joint supplements, a lot of science behind them. Love those as well. So there you go. There's a lot of different things that you can do as a pet parent to help your cat at home. Again, when it comes down to it, if the source of pain can be treated or removed, get that treated or removed because then the cat's not going to be in pain. But if your cat is suffering from chronic pain or they're recovering from surgery, all of these at-home pain management solutions can help you. To close out this video, I'm going to give you 4 things to not do. Number 1, do not give cats turmeric for pain. Turmeric is a natural compound. It's used in a lot of supplements. It's very anti-inflammatory in humans, but it is not bioavailable to cats when they eat it. They just have different gut biology. They don't absorb it, so it's a waste of your money. So don't do it. No turmeric for cats. Doesn't do anything. Number 2, don't get angry at these cats if they start having accidents in your house because of chronic pain. One thing for these older cats with osteoarthritis is that they can have a hard time getting in and out of their litter box, and so it can be painful for them to get in there. So they'll just go someplace else. So another nice thing you can do for cats is get litter boxes that have lower sides as well. But don't get mad at them. If your cat is urinating or defecating in your house outside their box, they're trying to tell you something. So it's a cry for help. Talk to your veterinarian and get some help. And then the last one, don't ignore the problem and hope it goes away. I know, going to the vet, it's expensive, it's time consuming, it's not very fun, but sometimes you just need to get a veterinarian involved so that they can deal with this problem. And if your cat is suffering, there's no reason why they should continue to suffer when we know what we know now. I know myself, I'm thinking about how undertreated dental diseases in cats and how painful it is. I had a bad tooth a couple of years ago, and I was crying in the dentist because it hurt so bad. So don't let that happen to your cat. If you are noticing the signs of pain, get help. That's all I have for this video. Thank you so much for watching. If you have things that you have done for your cat to help them live a better life and not suffer from pain, please share it in the comment section below. And thank you so much for watching. I will be back soon with more veterinary content curated just for you.